Hi, my name's Jessica, and I'm going to be your nurse today. Do you know why you're here?
Yeah. They told me I was supposed to get a cholecystectomy.
Well, that's correct, but actually it's pronounced
Cholecystectomy.
Cholecystectomy? Cholecystectomy. What's that?
Well, a cholecystectomy is a surgical procedure where the doctor's going to remove your gallbladder and help with the gallstones you've been having. He's going to use a tiny video camera and some special tools and inflate your abdomen and then remove your gallbladder.
Gallstones. How do you know I got gallstones?
From the ultrasound that we did the other day, it's like 90% accurate.
I don't like the sound of this surgery. Is there anything else we can do? Non-surgical?
Well, there are a few options to dissolve the gallstones, but that won't remove the source of your problem. Surgery is the only way to remove the source of the cholecystitis.
So I have to have surgery now, I guess. How long do I have to be in the hospital after the surgery?
Well, we're going to watch you closely. It's usually a 1 to 2 day stay, but sometimes you can get out the same day as your surgery.
So then,
Watch me. How?
each 1.2. Is this what you guys are doing for this one? It's 1.
Well, we're going to make sure you don't have any signs of infection, like tenderness, rigidity of the abdomen, and right upper quadrant abdominal pain. We're also going to look for any signs of infection, like anorexia, vomiting, pain, abdominal distension, and temperature elevation. And we're going to watch you for signs of jaundice, like yellowing of the sclera in your eyes, and your vital signs.
So I can't do nothing. What can I do after surgery, Because I don't want to just sit here.
Well, we want you to get up and walk as soon as you can after the surgery, but I don't want you lifting anything over 5 pounds for probably about a week. And take your medicine as it's prescribed by your doctor. Don't pull off the steri strips. Let them fall off on their own, and you can wash that spot with soap and water. Did you get all of that?
I don't know. So I should sit upright. Wow. Use a heating pad. So I also got to take my meds, shower, don't move those bandages, and don't move or itch those bandages. They're supposed to stay on as well. And then what about if I have an infection?
If you have any signs of infection like redness, tenderness, swelling, heat, drainage, or a fever that doesn't go away after 2 days, I want to make sure you call us. Alright, well let me know if you have any more questions before your surgery. I'm going to go see another patient now.
Okay, it was nice seeing you.
So I'm a new nurse. What do I need to know before taking care of this patient that just had a cholecystectomy? Well, keep them in low Fowlers, IV fluids. If abdominal distension is present, they need an NG tube for decompression. Also, administer analgesics as the doctor prescribes to help with that pain. What kind of things do I need to know for their respiratory status after the surgery? You need to have them cough and deep breathe to expand the lungs and help with their respiratory status. So will the patient have some kind of tube or drainage system after they come out of surgery? They'll have a drainage tube, and that needs to be fastened to their gown so it doesn't come kinked or dislodged. They'll also have a drainage system. Just keep that fastened to their shirt and below the waist and you'll be fine. Okay, that seems pretty easy. Is there any kind of special diet that the patient needs to follow? They need a low-fat diet, but high in carbs and protein. Well, I think I got it. I'll let you know if I need to know anything else. You sound like a pretty good nurse.